Hello everyone. I would like to thank you for your presence today. And we're going to present our study entitled Nationwide Environmental Scan of Knowledge Brokers Training. And this study was conducted in cooperation with Dr. Bussières, Dr. Sarah Ahmad, Dr. Aliki Thomas, and Dr. Kedar Met. It's recently published in the Journal of Continuing Education in Health Professions. And now I'll let Dr. Bussières provide the background of this study.
Thank you, Dina. Good morning, everyone. Real pleasure to be here, and a nice segue into the last presentation. So it's pretty well recognized that there's a long delay between knowledge production and uptake. In fact, it's been estimated it can take up to 17 years for only 14% of research findings to be integrated in routine clinical practice, which is really a generation and sometimes somewhat concerning. Obviously, research practice gaps can negatively impact the health outcomes of individuals and communities. And more specific to rehabilitation, some authors have estimated about 44% of physical therapists use research evidence to inform their practice. And only about half of the occupational therapists will use research evidence to develop interventions. Knowledge translation activities or implementation support strategies can be divided into two categories, with the active component being more effective, audit and feedback, educational outreach, interactive meetings being some examples. And intermediary agents or change agents, such as knowledge brokers and opinion leaders, have been found to be among the most effective in producing behavior change among the recipients, up to 12%, which is quite interesting. Knowledge brokers can be defined as one of the human forces which brings people together to build relationships, uncover needs, share ideas and evidence aiming to improve productivity. Knowledge brokers are used as a promising solution to reduce knowledge practice gaps and link research to the clinical world. Recent literature have shown that knowledge brokering activities are usually embedded in functions of managers, opinion leaders, researchers, and clinical educators, as was pointed out earlier. So why is there growing interest into knowledge brokering? Well, first, it's been widely used in various fields and in different contexts. We've shown and demonstrated earlier that it's been found to be effective in several healthcare settings, including rehabilitation. And knowledge brokers can occupy various roles, including information manager, linking agent, building capacity, facilitator, and evaluators. But despite this, we know little about the type of training that knowledge brokers get. We know little about the characteristics of the educational training opportunities, and furthermore, we're not sure whether these training opportunities actually meet the competencies that are required for knowledge brokering. Dina?
The overall objectives of this study was to identify and describe the current educational training opportunities for knowledge brokers in Canada, and specifically describe the characteristics of those training opportunities and determine whether those training opportunities meet the competencies related to knowledge brokers. A Canada-wide environmental scan was conducted to identify the existing training opportunities for knowledge brokers. And as eligibility criteria, those training opportunities should be offered to rehabilitation practitioners or graduate students in rehabilitation programs. The training opportunity, the content of the training needs to cover one or more of the knowledge brokering rules or the knowledge broker related knowledge or skills. The training objectives or outlines or expected outcomes should be accessible. And also the training need to be offered in English or French. 3 consecutive recruitment strategies were used. First, I searched the website of 106 rehabilitation organizations to determine if an educational training opportunities for knowledge broker were offered. Then an invitation email was sent to those organizations, including rehabilitation schools, regulatory bodies, professional associations, research institutions, and KT communities of practice. Second, follow-up phone calls were made to those organizations asking if if educational training opportunities for knowledge broker were offered, and the organization were asked to provide the content information of the individual responsible for those training to contact them. Third, a snowball strategy was used by asking participants if there is any other training opportunities we need to consider. Reminders were sent to the participants every 2 weeks for 6 weeks or up to maximum of 3 reminders. The data extraction sheet was developed and adapted from Hardern framework, which provide 10 questions to be asked when planning a course or a curriculum. Out of those 10 questions, 6 were related to our research objective. The data extraction table included course objectives, course topic and expected outcomes, learning strategy, and assessment methods. 2 independent reviewers extracted the data, and each course instructor was asked to validate the extracted data. Qualitative content analysis was conducted for the syllabi and the content of each training. The syllabi classified into administrative characteristics, learning strategies, assessment methods, and the content classified into knowledge, skills, and roles related to knowledge brokers. Then, quantitative numerical analysis was conducted by calculating the frequencies and the percentage of each category and subcategory of the syllabi and the content. To create an informative matrix, mapping of the knowledge broker's roles and competencies has been done. Knowledge broker roles labeled with letters, while knowledge broker competencies labeled with numbers. Then the frequency of each label was calculated. For the results, 84 educational training opportunities were identified and 51 were included in the data analysis. 21 were validated by the course instructors and 30 not validated. The findings showed that the training opportunities were only available in 3 Canadian provinces: Ontario, Quebec, and British Columbia. Rehabilitation clinicians in British Columbia have several trainings sponsored by regional groups like Fraser Health Authority and Vancouver Coastal Health. While Ontario and Quebec, most of the training were offered mainly in universities with significant tuition fees. The mapping process showed that the primary focus of the training opportunity was on developing knowledge brokering skills to fulfill the capacity builder role. And the second main focus was on research skills needed to perform the evaluator role. On the other hand, training developers paid less attention to the other types of competencies roles combinations, like communication skills for facilitator role, mediation skills for linking agent role, or knowledge and skills for information manager role. Now I'll let Dr. Bussières provide the take-home message.
Thank you, Dina. So to our knowledge, this is the first study conducted in the Canadian rehab setting, trying to understand what type of training opportunities would be available. And conclusion is basically that a comprehensive and accessible training still does not exist. And such training would help, obviously, in providing important skills in terms of communication and mediation skills, and better help prepare those for the roles of information manager, linking agent, and facilitator role. Thank you very much for your attention, and help you to entertain any questions.